future of healthcare has arrived. Artificial intelligence and machine learning are transforming the practice of medicine and improving patient outcomes. This is Smarter Healthcare with AI. Conversations with Dr. Hassan Tetteh as he shares insights into the healthcare of tomorrow and how we can help create it today.
I am honored to welcome my first guest, retired Lieutenant General Jack Shanahan. In his distinguished 36-year career in the Air Force, General Shanahan commanded at all levels and spearheaded the pioneering effort to accelerate ethical adoption of artificial intelligence to transform military operations. As the inaugural director of the Joint Artificial Intelligence Center, he established critical pathways to integrate advanced AI capabilities onto the battlefield, where he was also my boss. He not only is a kind and generous friend, but he's an inspirational leader. He was kind enough to gift my son a copy of Legend, an inspirational book which changed the trajectory of my young son's career. In high school, he was a rugby player just dabbling with the sport. After reading the kind inscription from General Shanahan, he adopted the sport with great vigor, went on to start as a junior and senior in his high school rugby team at Georgetown Prep, and is now currently a freshman starter for the rugby team at Wake Forest, where he is attending school. So with that, thank you so much, General Shanahan, and welcome to this podcast.
Well, Hassan, thank you very much. I am so happy to join you. It's fun to get the band back together, as you might say. But I'll also tell you how honored I am to be part of your inaugural podcast on this series. So it's just a pleasure to get back together again. And I know we'll talk more about our days at the Jake side by side, but it does have a lot of very fond memories, despite all the hard things that we endured together in that period before I retired from the Air Force.
Absolutely. And, 36 years is definitely a long time to spend in any endeavor. And you had the fortune of not only serving our great country, but being in numerous leadership capacities. And I know this podcast is about smarter healthcare and AI, but I think we'd be remiss if we don't give the audience a glimpse into the kinds of positions that you had, the work that you did throughout your distinguished career. What would you say was one of your greatest commands? And I know that might be a hard question, and you probably get a question similar to that in different occasions, but just curious.
The way I answer that is every command is a special opportunity. It really is a privilege. It's not a right. It's one of those things that not many people have that opportunity to command. And I was very fortunate to do it 6 different times at all levels, beginning with a squadron of 100 people, just maybe a little bit more than that, but not much more. And then by the time I finished my last command, a 2-star command in San Antonio, it was a 27,000 person numbered Air Force. And I've had multiple commands in between those that all were special for different reasons. And when I commanded out at the U.S. Air Force Weapons School in Nevada, it was not the flying organization, it was what they called the support division. But being part of that weapons school was special to me, just like all my commands were special. And I'll say, sort of the one that I would highlight as being very different than I expected after spending my first 15 years in fighter aviation, beginning with the F-4, that some people don't know, we flew that airplane, and then the F-15E. But then I was selected to go take a command of an intelligence group, which is a very different career path for an aviator. And they chose me for reasons that I won't get into here, but suffice it to say they wanted to bring in somebody with more operational experience and the user side of the intelligence business as opposed to the production side. So those things I used to maybe complain a little bit about in intelligence, I became responsible for. But that was the beginning of a very diverse set of experiences in my career. So I have to point to that one. But then I also did a command and control wing. And of course, I'm going to point to when I was commander of a flying wing in Nebraska, the 55th Wing, which was just outside of the Omaha, Bellevue, Nebraska, where I was responsible for intelligence, surveillance, reconnaissance, worldwide operations with people would say they're spy airplanes. I would say they're intelligence, surveillance, reconnaissance. We can quibble about what they were doing around the world, but every minute of every day of every year, those airplanes were deployed somewhere around the world, including never leaving the Middle East since Desert Shield, So the RC-135 went there in 1990, in August, I think it was. It's never come out. You look at that. I mean, 34 years later, it's stunning. But I just love that because it was a flying command opportunity. I got to meet with the crews and the linguists and the electronic warfare officers and all those other things that make command special. So that's a very convoluted way of saying I love them all. Just like I would never say I have a favorite sibling or anything like that. It's the same thing. Every command opportunity is different. I enjoyed them all.
And indeed, all of those experiences, and for those of us that have been in the military, and certainly for the few, very few that are privileged as you have been to lead at the highest echelons of command, each one of our experiences as we sort of mature and grow into each one of our different rotations and different assignments, we feel as if all of those experiences prepared us for our next command, right? And in the brilliance of the military, to some extent, whether it's by design or by mistake, it often happens that the greatest leaders are forged by the most diverse kinds of commands and experiences they've had, both geographically, in terms of the responsibilities and so forth. And then you arrive at the Joint Artificial Intelligence Center. And what was that experience like for you?
Well, yes. So let me go back for a second to what you said, because it really touches a fundamentally crucial point about every command opportunity builds on things that have gone before, to include the mistakes you've made. Which why you get to a senior command opportunity, you've pretty much seen just about everything that you could anticipate. Once in a while, you would get surprised, but I would say I was never shocked because humans are humans and humans will do very human things to get themselves into trouble. And then, of course, with combat operations somewhere around the world, you're always going to have something a little unusual going on. But everything I did was building upon something else I had experienced. And I made mistakes. We all make mistakes in command, but you learn from them. And by the time you're at that final one, you really feel like, okay, now this is doing. Now, when I got into the Joint AI Center, it was not a command. I was the director. That's the difference. It was an office in the Office of the Secretary of Defense in the Pentagon. But the reason it's important, I think, just to talk just for a minute or two about how I got there. So I had no AI experience per se in my life, although I had been generally following sort of what was happening in this world called AI back in 2015, 2016. And then we had a problem we couldn't solve, which was full motion video was coming off all these platforms, and analysts were looking at this video and they just could not process it. And we needed a technology that was outside the Department of Defense to be able to do two things, the 3A's, to sort of accelerate, to augment, and to automate what was going on. And I think those will come back as we discuss the healthcare piece of it. And so I ran this project called Project Maven for a couple of years, which was designed to help do that for all this video that was coming off of these platforms and letting human analysts get through that volume of information faster. And based on the relative success we had, again, we made a lot of mistakes, but we learned a lot, and we were groundbreaking. We were trailblazing for the Department of Defense about how do we put AI, not research and development, but put it in the hands of end users down somewhere else around in combat operations, and do it fairly quickly, 6 months to a year, putting those things into the field, so to speak. And the result of those experiences, I was then asked to stand up the Joint AI Center, which we called the JAKE, which, without getting into a lot of details, now been sort of transformed into something called the Chief Digital and AI Office, or CDAO, which you know very well because of your tenure overlapped in there. And so I came in as the director of this organization. Yeah, and as I say, we started with 4 people, no money and nowhere to work out of. And by the time I retired, we had 150 people, $1.2 billion budget over 5 years, and a brand new building, or an old new building for us to work out of, which is a stunning growth curve. And the whole point of the JAKE was to do those things that Project Maven wasn't working on, that it wasn't related to intelligence. And this is where, and we can talk more about this depending on the direction you want to go with this, is how we came to focus as one of our many projects on the medical piece of it, the Warfighter Health Initiative. This is a really important piece of it that I don't think many people that may be listening to this, when they hear AI in the military, immediately jump to visions of killer drones and all the warfighting aspects of it. This was as important to us as anything else, and I'm sure we're going to talk more about why it was.
We absolutely are, and I have a unique way of how I want us to bring that conversation to bear, because it will uh, it'll give us an opportunity to speak about our experiences that we now have as shared retired military folks. And I think you could probably tell where I'm going to go with that. But when you became the director of the Joint Artificial Intelligence Center as a new organization in 2018 when it was stood up, thinking about that time, right? It's almost like going back into prehistoric history, thinking about the fact that we, went through a pandemic, which was absolutely world changing. But back in 2018, when the JAIC was being stood up as a brand new organization in the Department of Defense, and thinking about that time, that era, thinking about the fact that the public, sort of psyche about AI was somewhat peripheral, and there was certainly not ChatGPT and sort of the zeitgeist of AI front and center of everyone's mind. You were taking the helm of a new organization, as you mentioned, without a budget, without a lot of staff, initially anyway, and convincing the leadership in the department that this was not only an important initiative, but it was critical to national security and defense, and it was necessary for us to embark on this journey. What were some of your challenges? And I know that we could spend the rest of the conversation talking about that, but I think it'll segue into smarter healthcare and AI in particular, because there is some unique things that I think you encountered, particularly at that time, that we are facing in the healthcare space right now as we grapple with this new technology.
Well, of course, there's a whole lot we could cover, but let me highlight a few I believe are the most salient. And first of all, you used a term which I will come back to, is just prehistoric. It was 6 years ago, but it feels like a different age, a different era, because so much has happened in AI, generally speaking, in society, but also in the military in those past 6 years. But putting ourselves back in the shoes of somebody that was standing up an organization that was immediately perceived potentially as threatening other people's budgets or taking people away from other military services, that was always going to be something we had to deal with. And so to build something with a lot of people and a lot of money meant people were immediately suspicious of us. And there was not an appreciation then, and I would still suggest maybe not enough still today, about what AI could do for the entire Department of Defense. And I will just say as an aside, I do find it slightly maybe ironic and amusing at the same time that some of the people resisting what we were trying to do are now sitting on boards advocating for AI integration across the entire country. So interesting to see your perspectives change once you retire and go somewhere else. But it was an uphill battle, and there's no question about it. But if you allow me to spend a minute here to talk about you. So I would like to claim that I had a master plan to go out and recruit you specifically and bring you in. It didn't happen that way, and I can't tell you how fortunate I was that you ended up in the organization. And the way it works is the military services, the Army, Navy, Marines, Coast Guard, were asked to give up people to the JAIC. And I didn't have a lot of people that were coming in with AI background or AI expertise or even AI experience. And yet you not only were willing to come into the JAIC, but you came in with a background that I classify you as a unicorn. Here is somebody that is an active cardiothoracic surgeon. First of all, an active doctor doing real doctor work, medicine work. You had written your paper at the War College on how AI could revolutionize medicine. You are already smart on health informatics, which becomes a big part of what we were trying to do on the data side in the JAIC. You were dynamic, engaging. You were the person that wanted to talk about human-centered healthcare and AI-assisted healthcare. I could not, if you had asked me to design someone like you, have ever figured out how to do it without calling it pure fiction. So you end up in the organization with this special skill set, and we had an opportunity beginning very early on to take on what we called, I think, the Warfighter Health Initiative, although we went through a couple of names there. But it was so incredibly important about taking that one on because we were doing these other things that related to warfighting operations and personnel systems and finance systems. We had a lot happening, but this one, you came in and you had a method, you had science behind it, and you knew what we wanted to take on, and we were off to the races. Now, the challenges are the same challenges we'll come back to, which is the challenges every company that's trying to embrace AI is going through, which is a data challenge, which is compute challenge, which is a talent problem, and on and on and on. So it can be very frustrating. for anybody outside the military, and as we saw inside the military, to become quite frustrated with what it takes to bring a pilot project to scale across the entire Department of Defense. And that's what we wanted to do, was bring it to scale. So that's sort of what we had in those early days. And it was, I say, we faced some tough bureaucratic headwinds in those early days. But I tell you, yeah, we all know that this friction and it is a crucible that makes us sort of tighter together. And we formed this team of people who had a common vision about how AI could change the entire Defense Department.
Well, General Shanahan, and thank you. You're very kind for your words of describing my pathway to the Jake. I was honored to be a part of the team, and it's so interesting, and it's an honor to see some of the Jakesters, as we call ourselves, so the alumni of that original group, out in the world now and doing numerous things, all leading in various ways in AI. And I think much of that is because of the stewardship of your stewardship of the organization, of course, your leadership, your example, and your grasp of the challenges. Because what you did for us is you enabled us, you empowered us, and you gave us information, and you gave us sort of a roadmap, as all good leaders do, in terms of how to achieve the mission, right? We were trying to transform the department, introduce this new technology to a group of people that were not necessarily fully embracing this, right? And the terms that you use, I think, kind of become germane to this podcast subject of smarter healthcare and AI, because it is now taking over, the public conversation in every domain. And in healthcare, no different at all. It is absolutely front and center in terms of everyone's mind. You talked about threatening the budget. You talked about people being suspicious. And the question of what can AI actually do for us in this field, whether it was in, logistics, so if it was in weapons, if it was in cyber, if it was in intel, if it was in healthcare, those same questions are being asked right now in every domain, in every sector of the world. And then, of course, what are the implications of AI? How will people's lives and how will their jobs and responsibilities be transformed? Those are the things that we're grappling with. And as we work through all of those different hurdles and those different obstacles and challenges, if you will, you gave us, I think, great guidance in terms of how to navigate that. And I think that came from your years of leadership, because you said we're still dealing with human beings. And I kind of feel like this to my core. AI at its fundamental core is a tool, just like any other tool that we've used before. We're using data and things that help us develop models and pathways and give us tools to help us do our jobs better. At the end of the day, we're trying to make the Defense Department more lethal, more agile, and more prepared for the future, right? So that we can protect our interests and national security. You talked about those 3 A's, and I want to come back to those things again, because let's think about that in the context of healthcare. And then I'd like to introduce the experience that I told you that we both share now, being retirees of this great organization called the military in the United States. But you talked about acceleration, augmentation, and automation. You really deliberate, but you also very strategic in how you articulated that being the central thing that we were always striving to do in terms of helping to improve the Department of Defense's operations and everything writ large. But let's talk about those 3 A's again, because you really use that as a framework for us to help us in our jobs of trying to articulate what it was that we were trying to achieve as a mission with the Jake.
At the center of that is what you say. This is, and again, I forgot to mention the other piece of you that made you a unicorn is you had written books on healthcare and what AI could do for healthcare, and are writing books even as we speak. That should be out soon. But the idea of people being the center of attention, there is a tendency today, and it's an unfortunate tendency, but it's not also surprising when you look at sort of the history and technology development, is to focus on the technology at the expense of the human. This idea of, I call it technological determinism, where just leave us alone in Silicon Valley and we'll figure it out and we'll all be right with the world. I just don't accept that, because it forgets that the people are the recipients of this technology, and the people need a voice, and they need to feel like whatever this technology is, however advanced it may be, doesn't take a human completely out of the equation. And in those 3 A's, I deliberately always would say automate last, because there was an impression that you're going to use this to replace doctors or intel analysts or the people in an airplane or whatever. That was not the intent. Although over time, I think the fact of any technology advancement is people will be repurposed over time. Some people will, some people won't. But this is why you want the first two A's, the augment and accelerate, to be the center of attention for a while, because there's so much to do just in those areas. Taking healthcare as an example, and our canonical use case for this was digitizing the slides from the Joint Pathology Center. That had to be digitized. There was no miracle cure to taking these real physical samples and just saying, how are we going to tackle these with machine learning or deep learning? Well, you had to digitize them. So there was a part of that, which was, how do we get through this process much faster? But the moment you did that, you could then use humans to augment what already existed on the AI side to get through enormously large amounts of information. And dare I say, as we talked about at the time, learning maybe some things about old COVID that could have been applied to new COVID had we done it in time. It's just we were facing the same challenges of finding enough people, money, and be able to do all this together. But that's why I put those two A's in front of the automate. I think over time, more and more things can be automated. But here's an important question. You come back to this. When you write about this, when you speak about it, the question is, should they be automated? And to me, the best value of all of this is going to be what I think anybody who's actually done AI in the production process will say is the combination of the human and a smart machine working together. The humans do things that only humans can do, still to this day, and I think for a long time to come. Deductive reasoning, inductive reasoning, abductive reasoning, context, putting yourself in a patient's shoes that maybe a machine has no concept of what that even means. And then using that together with the best of the machine to process data, to look at records that may go back centuries, and do this all in a way that can be done very quickly. This is what machines do. They process data. They're incredible at being able to draw correlations, not so good at causation still to this day. And that's the problem when it comes to healthcare. So that's why these three A's were so important to me. But I think they're somewhat transferable to the words of predictive healthcare, preventive healthcare, precise healthcare, and participatory. This is one of, maybe I could have come up with another A for the participatory piece of this, is how to make sure the humans are a part of this process, not just turning things over to the machine, so to speak.
So I want to put ourselves in the patient's shoes for a moment. Again, this is a podcast for Smarter Healthcare with AI, and we are uniquely qualified to have this experience because we've both now transitioned from the military. And as we transition from the military, especially after a full career, you are, by design, subject to an evaluation and now processing that has a large health component, right? You're essentially, you come in as this, younger version of ourselves, very healthy and fit without any kind of medical problems, most part, very healthy usually, and with little medical background. And then when you leave, through a host of different commands and different tours and just the aging process, you have a record of health problems that now are now being adjudicated as to whether or not they're service related or not, and how can the military help you in sort of this new chapter of your life. And as we went through that process, as I went through this process, as you went through your process, as millions of others that have transitioned out of the military have gone through their process, what were some of the things that you noticed? And I'm asking this question in this context. One of the things within the Warfighter Health portfolio was taking large amounts of data, especially when you look at the service member's health record over time, and helping to sort of accelerate and augment that process of evaluation and getting the right adjudication so that people, when they're out in the military, can get the care that they need, the care they deserve, and also, be comforted in the fact that they'll be taken care of in sort of their civilian life. When you went through this process as an individual, where were the areas that you saw AI being potentially a tool that could be used to not only improve your experience, but probably make the process even better?
Yeah, and everywhere, to be honest with you, everywhere. Just like I used to say this in the military context. I said AI can improve the entire Department of Defense from undersea to outer space and everything in between, and that includes this part of it. So if you just look at the process of going through the VA evaluation, disability assessment, and those other things, there's just so many different places where AI can be used. And it's interesting to me that on the digital side on the VA, their website is really, really good today. Now, do you get all the things you need by clicking in the website? Well, not necessarily yet, because it involves a lot of people and records and other things that have to be done. So let me probably turn to the biggest one right off the bat, which is electronic records. How to take, we used to PCS, permanent change of station, from one assignment to the next, carrying this big folder that, yes, to your point, would get bigger and bigger over the years. Although I've had many doctors tell me you kind of a small folder for being so senior. So senior, I said, yeah, but I was a flyer, so I did whatever I could never to go to the flight surgeon. Now, I don't recommend that for everybody, but that was the reality of it. And you carry this thing around. And now, of course, there's no reason to do that whatsoever. You can digitize these. You can put watermarks in them so nobody has done anything to corrupt the data that's in there or try to modify the data, whatever. But then just the process of going through this, it was a secret society that I had to rely on my front office to help me go here, sign it here, talk to this person here. And I had no major issues. I don't want to complain about it, but the process could be vastly accelerated by using AI. And even to the point now, imagine this, and this is probably something you're not only thinking about, you're not only writing about, you're probably beginning to figure out how to do it, which was taking sort of what we would call the machine learning, deep learning parts of AI and combine them with large language models or generative AI. So you can now have a what seems to be a conversation with a machine about, I'm about to retire. I need to get my VA assessment. What do I need to do? And instantly, here are the 15 things in priority order, and there are links to each one of those, and here's what you need to do. All of that can and should be done. As you know, the numbers are staggering how much we spend on just the VA part of healthcare in the United States. I want to say it's around $270 billion a year when you look at all costs. So there is a financial piece of this. There is a man-hour piece of this. There is just a user experience. How much better can we make for you and I and everybody like us? And honestly, as hard as it was for us, I had a front office to help me. I had two people that were dedicated to help me. They were my front office assistants. Put yourself in the shoes of somebody that's of a junior rank or a junior grade that doesn't know quite how to negotiate. And even if they're not at the 20-year retirement, they do want to know, where do I go get my GI Bill benefits from? How do I do this? I think there's so much that can be done. Now, the VA's got some really smart people from the U.S. Digital Service and elsewhere that have been helping them. So it's getting better. This is not a conversation about frustration, but it's a conversation that acknowledges how much more can and I think will be done in these areas.
Yeah, absolutely. And to your point, the great people that have helped me out, unquestionably great professionals and have helped and have helped me navigate that space. But the reason why I wanted to bring the context up for our listeners is the fact that you said it can be improved upon and AI could be used everywhere, I think is a template for how the civilian sector can benefit as well from, some of these advances in AI. For example, I'm a physician, I'm a cardiac surgeon. You are a high-ranking general who had staff to help them adjudicate that process. I have met, unfortunately, individuals who were not in spaces of just, advantage. The fact that they know something about medicine, as I did, but still had some challenges navigating that process. And yourself, which you had an augmentation of people to help you with that. And as we know, because of all of our years of experience and certainly downrange, folks that actually really, and fortunately for us, I think we kind of got to this period in time where we're, at a good health, overall. But some of our colleagues and some of our brothers and sisters in the military, actually needed a lot more and do need more care, from their injuries and from the challenges that they sustain throughout their careers. So I want to move on to the civilian healthcare space at this time, but we have to stop here. Coming up next time on Smarter Healthcare with AI, retired Lieutenant General Shanahan will paint his vision for the future of AI in medicine.
To have cures for certain maybe diseases that we never expect possible in our lifetimes, maybe they are possible because, one, you understand more about what the disease root causes are, but also the medicines that can be developed to go after those. So I think we're going to see a way to help humans out that it's hard to fathom right now because it is going to change so fast.
This has been Smarter Healthcare with AI. If you'd like to find out how to bridge the gap between medical experts and tech innovators and discover how AI can make us healthier and more human, go to Tetteh.com. Smarter Healthcare with AI with Dr. Hassan Tetteh is a production of Forbes Books.